Today, I'm going to be teaching you all the tools and protocols to optimize your menstrual cycle as a woman. We're going to be covering nutrition, supplementation, therapies for reducing PMS symptoms, and so much more. So let's start with the basics. What are the phases of the menstrual cycle? So day 1 is marked by when you start bleeding. This is what is called the follicular phase up until day 14. So days about 1 through 5 to 7, you could be bleeding, but all the way up until we ovulate is going to be the follicular phase. And you can think about that as F for first. Then we have the ovulation phase. So that's going to be roughly days 14 through 16. And then we have the luteal, and we can even subset that into late luteal. Luteal is going to start right after we ovulate, and it'll run through the end or up until day 1 again, or the bleed of your next cycle. If you are a woman and you don't track your cycle in any way, I would highly encourage you to start doing that. I use the Oura Ring with Natural Cycles integration. There's lots of different ways you can do this, but if you start to understand your cycle, you can start to empower yourself to really optimize it. So we're going to talk about how energy can change and how our hormones are changing throughout these different cycles of our menstrual cycle. When we're in the follicular phase, our estrogen is the highest. So estrogen is super protective. It's really great for recovery and pushing yourself the hardest. You might actually need a little bit less sleep in the follicular phase. So you may need a little more sleep in the early follicular phase or during the bleed phase. And then once you're done, you might need a little bit less sleep. You can perform at some of your highest numbers. Lots of high intensity interval training at this point is great. Lots of, really incredible strength training. And I want to be clear about something. I don't think that you should plan to reduce training because of your menstrual cycle. Everybody is bio-individual. Personally, I don't have PMS symptoms. I'm going to talk through why I think that is and what you might be able to do to mitigate or improve yours as well. But I don't plan to decrease my activity or my load in my luteal phase. Although if you're feeling sluggish or feel as if your body needs it, I completely understand. And we're going to talk about why that may be in just a second. Follicular, we have the benefits of estrogen, may need a little bit less sleep. Performance can be absolutely amazing. We're also more insulin sensitive. So we can handle and process carbohydrates a little bit better. So you can think about that for nutrition. Another point on nutrition is during the bleed phase, I also consume more red meat because we're actually losing iron during that time. Let's now move into ovulation phase. So this is when we can hit our highest PRs, recover the absolute best. It's a short phase, but if you do really want to optimize your training, you could plan to hit some PRs at that time. Now, when we shift into the luteal phase, something called progesterone starts to increase significantly. This can make us feel a little bit more tired. You'll see a shift in your body temperature. So if you're using an Oura Ring or some sort of tracker, you'll see an increase in your baseline body temperature, which is interesting because it could make things like doing sauna a little bit more difficult because your body is already hotter. Could make really intense exercise slightly more difficult because your body at a baseline is already warmer than it is in the follicular phase. So in luteal phase, in terms of nutrition, we can think that our body is less insulin sensitive. So if you're wearing a blood glucose monitor like I am right now, we might have more blood sugar spikes. But there's also the caveat. So it's a really interesting conversation around this. So we are less insulin sensitive. So you would want to think less carbohydrates, right? But we also need some of those complex carbohydrates to build our progesterone. We want to allow progesterone to increase for really balanced cycles. So we just want to focus on those complex carbohydrates, and ideally with a meal at the end of the meal. So things like, lentils or a great sweet potato. Also, if you wear a blood sugar monitor, you can know what carbohydrates spike you the least. And you can also focus by incorporating the carbohydrates at the end of the meal. The fat and the protein will help to blunt that blood sugar response. You can also do about 10 squats after, or take a postprandial walk for about 10 minutes, and it also can help to decrease those blood sugar spikes. We don't want to increase the blood sugar spikes because it can lead to brain fog, more moodiness, and just overall not feeling our absolute best. So that's some nutrition in luteal. In terms of workouts, again, as mentioned, if you feel like you need it, you can start to decrease a little bit of the intensity. I still focus on strength training. I still focus on VO2. I'm still doing my stretching and mobility. But if you need to, you can dial that back slightly. I wouldn't change my entire regimen, but you can dial it back slightly. So that's the phases and what we can do to potentially optimize each one of these phases. We talked about diet. Also important to mention that during during the late luteal and menstruation phase. We might need a little bit more sleep, even a little bit more sleep potentially in the luteal phase in its entirety, with sleep needs and requirements increasing the further we get along in that luteal phase up through menstruation. Obviously, our body is burning more calories when we are actually menstruating, and we really can practice self-care during these times, again, depending on how many PMS symptoms you are having. Now, let's talk about a few supplements that can be beneficial to optimizing your cycle. The first one is omega-3, so really high quality omega-3. I take Omegagenics by Metagenics, and this is anti-inflammatory. It's not only good for your cardiovascular system, but really great for potentially reducing that inflammation. Magnesium glycinate can be a game changer for cramping, so maybe 300 to 400 milligrams per day has been shown to give beneficial effects. Another supplement called chasteberry may be beneficial for women with late luteal defects or luteal defects, so maybe a too short of a luteal phase. You do want to be cautious though if you have PCOS, because this is not recommended for individuals with PCOS. So chasteberry actually works to stimulate the pituitary gland to increase LH and progesterone. But in PCOS, LH is already elevated, so this isn't something that you'd want to incorporate. People with lean PCOS or those with low progesterone and low LH might benefit under practitioner guidance, but for the majority, especially if LH is elevated, this Vitex or chasteberry may be counterproductive. Vitamin B6 also helps with mood by supporting the neurotransmitters. About 50 to 100 milligrams in the luteal phase can be ideal. Another supplement is zinc because it supports healthy ovulation and reduces cramping. You could do about 15 to 30 milligrams per day. If you have irregular cycles or PCOS, myo-inositol can improve insulin sensitivity and promote regular ovulation. Now we're going to talk about red light therapy or different potentially devices that can help with reducing the symptoms of PMS. So red light and near infrared reduce inflammation and they improve energy. When you apply them to your lower abdominal or your back for 10 to 15 minutes a day, it can support ovarian function, and it can also ease cramping. This is especially helpful during your luteal phase and menstrual phase, and other potential options are PEMF, so pulsed electromagnetic field therapy. Again, may be able to help with some of the inflammation and also helps to energize our cells. So may boost energy, and reportedly, if you are having cramping, I've often heard that this can be a great intervention to help that. So the red light and the PEMF for improving cramping symptoms. I'm also using hyperbaric oxygen therapy at really specific intervals to see if I can actually reduce the inflammatory cascade that occurs when we go through our cycle. So as we build up that lining and shed it, it can cause an entire inflammatory cascade. So I'm doing HBOT about 3 to 5 days prior to starting a bleed, and then throughout to actually see how much reduction that we can get in terms of the inflammatory processes that are occurring. It also could be helpful for improving blood flow to the area, ovarian health and longevity long term. I know there's a lot of studies and research going into HBOT and ovarian longevity, but that's definitely something that I'm trying. The next thing would be, of course, again, prioritizing high quality sleep. We know that if you sleep less, you'll have more cortisol, which is more stressful to the body. When we are in this luteal phase, we already have some more stress on our body leading up to menstruation and throughout menstruation. So it can be really helpful to, if you're not prioritizing sleep, which I highly recommend you do throughout the entire cycle, really focusing on it when you're in these phases, because we know that it can increase cortisol, increase pain, it can increase our hunger hormone ghrelin, so we'll have more cravings. If you're already having cravings in that late luteal phase, lack of sleep is just going to intensify that and magnify it majorly. So really focusing on high quality sleep. We touched on it slightly, but keeping your blood sugar in check can really also help with these PMS symptoms. So if you want to, you could try a glucose monitor, or just always ensuring that you're not having high sugar snacks, added sugars, refined sugars. And if you're going to have any sort of sugar at all, putting it at the end of the meal can be super helpful. There's also at-home finger strips that you could just prick and see what your glucose is throughout the day. That might be a good option for someone not wanting to invest in continuous glucose monitor, but optimizing blood sugar will definitely help PMS symptoms. Going back to HBOT, this is just something, first principles thinking, is that any women with anti-ovulatory cycles, meaning you're not ovulating, or PCOS, could benefit from a consistent HBOT practice by improving the blood flow, by helping to optimize the hormones, potentially improving the gut health. And there's also a lot of benefits for skin, just as a side note, that you could get while doing these HBOT sessions. If you're not already thinking of your menstrual cycle as literally a biomarker or a vital sign, I highly encourage you to change the way that you think. Having consistent cycles and tracking your cycle is an absolute game changer for our health. This is literally a monthly check-in that we get as women to understand more of our health status. If we are not cycling, I highly recommend that you work with a provider to optimize your cycle. There are so many new resources out there. If you find this video interesting and want to learn more about female health optimization, I would love a subscribe, a like, and a comment.